It's now time for hospitals and insurers in the state to explain their plans for lowering costs while also improving quality of care. We will hear first from a group of CEOs from the region's hospitals and hospital systems. We've met with them all and had in-depth conversations with them. They have been briefed on the format and questions for tonight well in advance and have agreed to them, including to a strict time limit. They will each speak for no more than 4 minutes. When they have 1 minute left, a helpful reminder will flash from our timekeeper, Ms. Wainwritz, right here, this team, from Temple Isaiah in Lexington. And another reminder again at 30 seconds. When time is over, Ms. Wainwritz will stand, speakers will complete their final sentence, and we will prepare to move to the next speaker. I should also add, they've received questions ahead of time. We're not taking questions from the audience tonight. We ready to begin?
Yes.
Let's proceed. Lisa.
Good evening, GBIO, and good evening, hospital leaders.
Good evening.
I'm Yusuf Ibali, the Executive Director of the Islamic Society of Boston Cultural Center, the ISBCC, the largest Islamic center in New England. At the ISBCC, our Friday service serves over 1,300 worshipers who run the gamut, from many doctors, nurses, techs, and research fellows working at your institutions, to hundreds of Medicaid and Commonwealth care patients, to nearly 100 small business owners, and everything in between. I've been tasked to ask all the hospital leaders to answer the following general question. Please describe specific and measurable ways that your organization is working to meet the cost growth benchmark while maintaining or improving the quality of care that patients receive at your institution. I'll also be asking an additional organization-specific question to each of the hospital leaders. I'd like to first ask Dr. Kevin Tabb, the Chief Executive Officer of Beth Israel Deaconess Medical Center, to answer our questions. Thank you for being with us tonight, Dr. Tabb. Dr. Tabb, your organizational specific question is, you have characterized Beth Israel Deaconess as finding a third way, distinct from either that of partners or that of stewards, in creating a healthcare system for the future. Can you briefly tell us how your system's vision is different and will advance high quality and affordable healthcare? Please come up with it.
Thank you. Good evening. Salam alaikum and Bochim abayim. First of all, very difficult to follow a rabbi and a reverend and a patient. It's quite difficult. Let me start by thanking GBIO for inviting us here this evening, and more importantly for your leadership and critical role that you've played in both enacting the healthcare reform in 2006 and keeping a continued focus on affordability and accessibility. Because I've only got a few minutes, I want to launch directly and to answer both of the questions that have been posed to me. And namely to discuss measurable ways that our organizations can work to keep costs down and improve quality. So I want to start with the present state, the facts as they are presently known, and point out 3 things. First of all, publicly available data provided by the Attorney General's office confirms that the prices we are paid by insurers are substantially less than our closest competitors for providing very similar types of complex care. And this amounts